Alrighty, so we're going to do a little review on the Dr. Pen microneedling system. So I have been doing microneedling on myself and on clients for, I would say, well, I've been a beauty therapist for 9 years, so maybe like 7, 8 years I've been doing microneedling. So I've used rollers, I've used pens, I've used stamps. So I'm really interested to see what the system is like. Just because of the price point, it kind of seems too good to be true. So I'm gonna go wash my face and then we'll get into it. Okay, now that I've washed my skin, I think this lighting is far too generous, but I have, you can kind of see here, I have very deep pitted acne scarring. So for me, I would need to needle my skin at a 2 to 2.5 millimeters, which is what the Dr. Pen M8 goes up to. So this is the little device here, and you attach on your disposable cartridges. So you put one on, you use it on one person one time, and then you take it off and put it into a hazards bin. Sounds like an electric toothbrush. You've got your different settings there. So it goes all the way up to 5. Yeah, what I'm gonna do is I'm gonna put on the hyaluronic acid onto my skin and infuse it. But first, what I have seen lots of videos of people doing is not using gloves, even if it is on yourself, and not preparing the skin properly before needling. So even though I've double cleansed my skin, it is really important that you somehow put some sort of antiseptic substance onto the skin. So it can be alcohol wipes, a little bit iffy about it. I would try for more chlorhexidine, which is like a medical grade, very safe on the skin, disinfectant. So we're going to put that on my skin with gloves, and then we're going to get into the needling with the hyaluronic acid. Okay, so this is the chlorhexidine prep pads that I have. So this is a hospital grade disinfectant for the skin. So surgeons will use this before they go in with surgery, cutting people open. So it's very safe to use on the skin. Yeah, like I said, a lot of people do put like alcohol wipes on their skin before they do the needling, but alcohol is extremely stripping for the skin. So I would try something a little bit more gentle like the chlorhexidine. And if you're doing it on clients, then the chlorhexidine doesn't smell like alcohol, because that is extremely fumey. So I'm gonna get some gloves and then we're gonna crack on. My skin is quite red. I have quite sensitized skin, so I was a bit on Roaccutane for like years. Obviously I'm not on it anymore, but when I was on it, we all know that Roaccutane creates sensitized skin, and I did some terrible things to my skin when I was younger, like St. Ives scrub. Okay, so let's get into the chlorhexidine wipe. So it comes as like a little square. And this is also a lot better than alcohol wipes, because you'll probably find that alcohol wipes really sting your skin. So I use one side of the pad on one side, and then we're going to flip the pad over and use the other side on this side. I mean, you can go down your neck. Today I'm going to concentrate more on my cheeks, and I'm going to do my forehead as well. That in there for now, and then I'll pop it in the bin. So when you get the pen, it comes with your little manual, and then it comes with your charger and your little charger socket, because this can either go into a computer like USB vibe, which is great. And then it did come with 2 cartridges as well, the disposable ones, and I ordered an extra, did I order an extra like 20, I think, cartridges, because my mum wants me to do it on her too. So this is really great. Like, this makes me so happy that it's super sterile. I'm like super thing about being sterile and whatnot. Like, how do I get into you? Okay, so you can probably see, can you see that? It's a bit blurry. That the way this is structured, it definitely, you have to make sure it fits in the right way in here. So you should be able to, so you push it in, you'll be able to feel it, and then you have to twist. And that's secured in, because if you don't have like a system that has the twist, when it vibrates it might fly out. And then it's got this little cap here which you pull off, and then in here, does that even work when people like put their hand behind there? Don't know. Anyway, in here there's like tiny weeny needles. So the idea of this pen is the needles are pointing down this way. The idea of the pen, when it vibrates, it's going in and out, in and out. So depending on like on the dial here, what size, what depth you're going to go for. So I'm going to go all the way up to 2.5. So you can see that the needles change on here when you do it higher. But basically, the higher the number, the deeper it's going to penetrate into your skin. So it's going to penetrate into my skin up to 2.5 millimeters. And you want to get down to that depth if you're going to regenerate new collagen and elastin, right? So for pitted scarring, that's what you're wanting to do. What the microneedling does is it creates like these little tiny channels in your skin going all the way down to the dermis, where your fibroblasts are generating collagen and elastin. So because you're hopefully wanting to get blood when you're doing it at that depth, you're creating a wound response. So your body thinks and your skin thinks it needs to regenerate collagen and elastin again. So by creating a wound effect, you're hopefully going to regenerate new healthy cells coming through. So let's crack on, shall we? So I'm going to use the hyaluronic acid, just pure hyaluronic acid, and I'm going to put this on my skin, not touching the dropper onto my skin, because that is super unhygienic, isn't it? Damn, this is quite thick for hyaluronic acid. Okay, so I'm just going to put it on one area of my face at a time, and then we're going to go. So, because I'm quite savage and I've done this on my skin so many times, I'm going to crank it up to 2.5, and I'm going to do the highest setting, which is 5. Is it even going in and out? Or is it just straight up vibrating? I don't even think it's going in and out. I think it's just straight up vibrating. Oh well. Oh my god, I forgot how painful this is. Okay, so my skin's nice and red. I just did my cheeks, a little bit on my chin, and just up here. If I were to do like around my eyes, I would do it at a very shallow depth, like 0.25, because the skin is so thin around there. And if you go too deep, you can actually damage like your eye ducts and things like that, so it's just not worth it. So my final thoughts on this, it'll be interesting to see what my skin looks like tomorrow, but it definitely does, like, this here changes the depth of how deep it's going to go. But as for like microneedling pens, what they're meant to do is this little thing's meant to go in and out, and it just vibrates. So you kind of have to stamp it yourself to get it deeper. which is fine to stamp it yourself, but that's kind of not the point of a microneedling pen. So I'll probably still use it though. Like it's definitely done something. So yeah, we'll have a wee look, I suppose. So yeah, I will see what my skin's like tomorrow. Maybe I'll insert a photo or do another video or something, and let you know my final thoughts after that. Thanks for watching. Alrighty, so it's the morning after doing the needling on my skin. Wonder if I could change the settings so they're warmer or something. Maybe not. Can you see? So my final thoughts are, after watching the video back in slow motion, you can actually see the needling pen does go in and out, but my problem is it doesn't go in and out quick enough. So if you were to drag it on your skin, the needles are going to be in your skin and you're going to be dragging it across in your skin, creating like track marks. So I'm going to continue stamping it rather than dragging it on the skin, just because the up and down motion doesn't actually go quick enough compared to other pens that I've used before. So price point wise, that's probably why the Dr. pen is a lot cheaper, just because they don't have that technology of going up and down fast enough, I presume. But I do like the results so far. I mean, it's still quite red today, which is quite normal for me, but it's really helped plump out all my scarring and everything. It's so hard because you can't actually see. Going forward, the hyaluronic serum that it came with is quite thick, so I personally will go and buy some serums that are compatible with microneedling, that are a lot thinner consistency, so the molecular structure of it will be smaller, a lot finer, so it'll actually penetrate a lot easier through the channels that I've created with the microneedling. But overall, I'm going to carry on using it, and I do think it is pretty good. I think if you're going to do it on yourself, and you're going to use like those higher settings around the 1 to 2.5, that just be aware it doesn't go up and down that quickly. So maybe just try the stamping and take your time with it. So hopefully this helped, and let me know if you buy it, what you think of it. Yeah, thanks for watching.